Okay, thanks, Jason. I kind of lost track in terms of how many weeks that we've been at this now. It seems to me it's been at least 7, if not 8 or 9 weeks that we've done this kind of weekly update, and I just want to thank you and the channel again for having me on. I guess I'll start with the little bit of good news that we have for the week, and that good news is that if you remember last week, there was a whole series of different initiatives that the governor rolled out in terms of money from the $1.9 billion federal money that came for the coronavirus crisis. This week, there was specifically money allocated to both the county and also the city. It was part of a $200 million package, and Kenosha County will be receiving a little bit over $2,700,000, and the city will be receiving $1,600,000, a little better than $1,623,000. So this will help pay for some of those costs that the city and the county have had to kind of dole out on their own. So this is good news for city taxpayers and county taxpayers. And that's kind of where the good news ends, I'm afraid. On Wednesday of this week, we had like the biggest spike in both deaths and also in new cases. So I'm afraid that the news on that front is not very good. And that news came on Wednesday, 2 weeks after the Supreme Court ruling. And that brings us to just under 17,000 deaths in the state, and just under 550 deaths in the state, and just under 17,000 active cases. And here in the county, there have been 25 deaths, and we are now, as of, I believe, Wednesday, we were at 1,088 active cases. So I just want to remind everybody that this is far from over. And the Kenosha News had some stories in the paper this week, and those certainly were good news. We have some serious outbreaks in our area nursing homes, and also 7 bartenders, presumably, who were working on the first night that the bars opened, have now tested positive. So I would just like to remind people that we are far from out of the woods. I saw a epidemiologist, Michael Osterholm, this week, and he said that we are in the second inning of a 9-inning game, and this is more of obviously the beginning of the crisis than the middle or the end of the crisis. He is from the University of Minnesota and a leading epidemiologist. He is the author of a book, The Deadliest Enemy, Our War Against Killer Germs, and it has a new preface on the COVID-19, little reading to keep you up at night if you're looking for a new book. So I would just like to say a couple things, which I normally try to do here. And first of all, I know that one of the problems that a lot of people are dealing with the COVID crisis is that they're not getting their unemployment checks. And even though we have, the state has sent out millions and millions of checks, that doesn't do anything for the tens of thousands of people who are still waiting. And unfortunately, that comes as a result of having a 50-year-old software system. And also, I think the number is like 600 times the normal with a high call volume that people are experiencing. And none of that matters to people who have been waiting for 6 to 8 weeks for a check. I fully realize that. And I would just like to say that if anybody is having trouble accessing their unemployment, please give my office a call, and we will certainly do what we can. And my office number is 608-266-0455. And we also, if you want to get on my list to receive a coronavirus update that we do, once again, nearly every week now, I think, for the last 8 weeks, go ahead, and when you give them a call, just ask your name to be added on that list, and give them an email address, and we will be pleased to get that to you. So I just want to reiterate what I have in the past, that that a lot of people are obviously having a rough time in this new situation that we're in and having trouble kind of dealing with the fact that they haven't been able to see their friends and see their family, and see their loved ones, and get out and kind of enjoy life in a normal time. And if you're having trouble, or if you know of somebody having trouble and you're looking for somebody to talk to, please give them the number of the crisis hotline, and that's 1-800-985-5990, or have them contact another doctor or somebody who that they feel comfortable talking with, and say that they need some help. And feel free to give our office a call if you're having that situation as well. I guess I will just close by, unfortunately, we are far from out of the woods, and because of that, I would like to encourage people to wear a mask when you're in public. I had met with some friends this Memorial Day holiday right after the veterans event at the Library Park put on by the Vietnam veterans, and they were kind of shocked at the number of people that were not wearing masks here in Kenosha versus Chicago, where they were from. They said that almost everybody that they see on the streets is actually wearing a mask, and I would encourage you to do that when you're in public. We also have to remember social distancing is important. We know that people should stay 6 feet or further apart from each other, and I know that that's difficult to get used to, but I think that that's going to be the new normal for us for quite some time, and we should certainly remember to do that. We also have to remember to wash our hands more frequently. Is elementary as it sounds, it's one of the most important things that we can do. And also, don't touch your face, don't touch your eyes. These are important little things that we still have to remember to do. Just also remember that we're still safer at home, and obviously we're social beings, and there's times when we have to go out, but work on the yard, read a book, spend time with your friends, family that are close to your small inner circle, and just make sure that you try to stay safe. And I guess I'll close by once again thanking you, Jason, for the opportunity to have a few minutes to pass on this news, and I fully expect to be here and talking to you again next week.